Welcome to another edition of the Deals for Dentists podcast. And today we are joined by Dr. Ahmed Soboh. Thanks for joining us.
My pleasure.
Dr. Soboh is the founder and inventor of a product called TMJaw. And you can go to dealsfordentist.com and you can find their promo offer, which is purchase the TMJaw kit for $79.95 or $69.95 for orders of 10 or more. And then you can resell it to your patients for $100 to $150. So thanks so much for joining us. Tell me all about your story and how you help dentists.
Oh, thanks, Eric. My pleasure. Thank you for having me on your show. I'm so honored and pleased to be talking to you and to your audience. And to those who are listening to us today, I think it's absolutely my pleasure to be of any kind of help to you and your patients when it comes to TMJ problems. As many of us know as dentists, maybe the last patient you want to see in your office is a TMJ patient. Someone coming with TMD, having severe pain, not knowing what to do. I mean, some dentists are brave enough to try put a night guard in the patient's mouth and prevent bruxism, damage for teeth, but that does not necessarily solve the TMJ problem or any TMJ symptoms. Many of us, when we face something like this, we get puzzled or try to find a place where we can refer them or throw them off. So most of us send them out to the oral surgeon. Some of us will send them to ENT physicians. But for many, many years, it was always a puzzle. It always something mysterious, those TMJ patients. Not to forget and not to ignore that there is a psychological factor in it. So many of the TMJ patient comes in, they're either depressed, have some anxiety, and they also have a psychological component to the problem. So I faced that problem many years ago. I've been practicing dentistry for over 20 years. And at the beginning of my practice, I found out that this is actually a common thing. It's not uncommon. And one day I was sitting down in a class and they will start talking about the relationship between occlusion and TMJ problems. So I decided to get into the learning more about this field of dentistry. And the more I learned, the more I got puzzled, the more I found it more mysterious. And the fact that there are no consensus among dentists and schools of thoughts nowadays of what causes TMJ. Many schools of thoughts think it's occlusion. Others who disagree with them and say, no, it's all neurological. It's all in the nerves. Others say, no, it's in the muscles. And all these schools of thoughts are actually existing in the United States and many places around the world where they fight with each other. They don't like each other's philosophy. They don't like each other's concept. So I decided to go through each one of them. So I got a residency in neuromuscular dentistry. I got a residency in craniomandibular school of thought, even orofacial pain. I got a mini residency from UCLA, where mostly it's focused on the neural part of the problem. And I found that each one of them has a piece of the truth. Each one of them has a piece of the big picture. And I was able to put them all under one roof in my office and try to use all that to treat TMJ patients. So most patients who come to me are referred from orthodontist, oral surgeon, ENT. Many patients go to the ENT because they have ear pain, and the ENT will tell them, no, it's nothing wrong with your ears. Go to see a TMJ doctor. So I was able to treat many patients in a very high successful rate. From getting all these symptoms, got them out of headaches, migraines, jaw pain, neck pain, shoulder pain, and many others. But the problem with TMJ treatment, it's very expensive. To do it right, it's not just simply a night guard. It includes many things, many sophisticated equipment, a lot of time. So it is expensive treatment. It can reach anywhere between few grands to tens of thousands of dollars to get the treatment done and get patients completely out of pain. And that's not mentioning surgery, because I don't prefer to do surgery. Surgery is like the last resort that we like to go through. So with that said, many patients around the United States do not have access to TMJ doctor, don't have access to this treatment or cannot afford it. So I started thinking, what if we just create something that could be affordable, a temporary solution, temporary relief that will get the patient out of pain, help them go through get out of these symptoms until they're able to afford TMJ treatment, or until they're able to find a TMJ dentist who's able to fix the problem permanently. So that's where the story of TMJaw came to be. I spoke to pharmaceutical companies and I said, listen, I need a product that will do this and this and this and that. And we spent 6 months researching products, finding out which chemical, which natural product can do this. And we put them all in one product that's called the TMJaw. And it's one component is to soothe and relax the muscles, one component to relieve the inflammation that's around the disc area, and one of them is to work on calming the nerves and the neural activity in that area. It's not a medicine in the terms like it's like an FDA approved medication. It's mainly like a supplement, like a vitamin, like some of these products that you buy over the counter in the stores. So that's what the TMJaw product. So, and then when we were designing the product, we needed to have topical component and a systematic component. So we found that, so the TMJ kit includes, the TMJaw kit includes the bottle of capsules that have 90 capsules in it. The patient will take 3 of them a day for 30 days. And also the bottle of the cream, that's the topical, the same components of the capsule that just put in a cream or an ointment that the patient will rub it around their TMJ area. In addition to that, we put like a small tutorial to teach patients how to do stretching and exercises for their muscles around the TMJ area, around the neck area and the facial area. These stretchings work like any physical therapist that you go to and they want to treat your back or your neck. They teach you how to do certain stretches for your body. In addition to that, the TMJaw kit will have, if someone buys it online, it does have the homemade custom-made night guard, which is like a very primitive way of doing a night guard, like a little, you just put in hot water and put it in your mouth. But that's only for patients who buy it online. If a dentist is given TMJaw kit to a patient, my advice is to do a soft night guard or a hard night guard, regardless which way they prefer. If they are trained in neuromuscular dentistry, then definitely an orthotic, a neuromuscular orthotic will be a better option to add to the kit. I think that's a long answer for your short question.
Okay, so the TMJaw, so this can actually be purchased by a patient online. They can.
Yes.
Okay.
Patients can buy it online and they can get it on our website, the TMJaw website. And usually patients buy it for the bottle and the cream, the capsules and the cream by itself is around $99 that is sold online. But if someone gets the whole kit, usually in our office, we sell it for $150.
Okay, and what's in the capsules and the cream? What's the chemical composition of it?
So it's natural products that are created or put together by a company called All American Pharmaceuticals. I think they are in Montana. You can look them up. All the components in it are made in America. The capsule itself is vegetarian made capsule. So anybody who have allergies or anyone prefers not to get anything that's made out of animal products will have no problem with using it or consuming it. The main 3 components that are in the capsule, one of them is to work on the relaxation of the muscles. It's like a natural muscle relaxant. The other one is a neural effect, has a neural effect. It affects the nerves by calming the activity of the nerves. And then the third one is anti-inflammatory, again, natural anti-inflammatory product.
So these are all natural. And now is the key doing all 3, the capsules, the cream, and the exercises?
And the splint or the night guard, that's either made by the dentist, because what some dentists who buy from us, what they do, they make the night guard or the orthotic and they charge separately for that. And then in addition to that, they sell the TMJaw kit as an additional or as an adjunct factor to get the patient feeling better soon.
Is the one that the patient buys, is that like a boil and bite type of
Exactly.
appliance? Yep. Okay.
That's the one they buy it online. Yeah.
Okay. So this is a whole program for patients to try to but this, you said this is more of like a temporary relief to get them by until they can afford.
Yes, I would say many dentists can relate to that. There's a product called Oragel, I think, or Amsol, something like that. When a patient has an irreversible pulpitis that they cannot find a dentist to do a root canal for them, they get Amsol or Oragel and they apply it on the tooth. That will give them temporarily soothing until they are able to afford going to the dentist and doing a root canal. This component, it could be used in that manner, in that way. Let's say a patient walks in to the dentist's office and they're saying, I'm having TMJ problem, I'm having pain and limited mouth opening, those acute symptoms. If the dentist is able to make them a night guard, maybe a hard lower mandibular night guard, and give them the capsules and the cream, they will start feeling better much, much sooner. There are patients who buy it online on regular basis. They buy it every month on monthly basis. They buy it, and I've had patients who've been using it for at least 3-4 years who buy it regularly. Last year, when we were going through COVID, we had limitation in the amount that we can order from the pharmaceutical company. They could not, we cannot place large orders. So some of those patients, they could not get the product for 2 to 3 weeks later, and they were calling every day. We want it. We cannot afford going without it. So some people use it on regular basis. There is no harm in it because it's all natural if they choose to do it that way. And others, they just need it for a month while they're using the night guard or the splint. And some will use it once a year or once every 6 months. They'll rebuy it again
if they have a flare up.
Yes.
Yeah, I noticed the exercises. Are those to kind of strengthen the muscles and increase mobility? And by doing that, can some patients actually get better and relieve long-term, their symptoms just by doing these exercises?
Absolutely. Even as a TMJ dentist who I treat patients with TMJ, some of my patients, I don't have to treat them. I just give them the exercise and the TMJ and tell them that's all what you need.
Yep.
Some of them, they had a car accident, they got a whiplash, all the muscles are tense and spasm. They just need stretching and some kind of relaxing of the muscles. And then after that, they'll go back to normal. Some of them are traumatized from especially young girl who plays soccer, they get those muscle spasms of their neck all the time, tense. Someone did an ortho treatment and they caused the treatment caused some kind of muscle spasm or muscle tension. So not everyone needs full-blown treatment of TMJ treatment, but some of them actually will just use the TMJaw product either on a permanent base or every few months, and sometimes just for one time, and that's it.
Yeah, if they're coming in and they're all flared up and they're locked or tight and in pain, it's a good way to, relieve those acute symptoms until you can move on to a different treatment. Now, I noticed the exercises. It's a 5-5-5 system, so there's 5 exercises. Number 4, I've been doing for years. The one that's number 4 is sniff your armpit. I've been doing that one for years. I'm very good at that one.
Good.
Number 5 was, I was watching the videos. I'm also very good at because it creates a double chin. And I have that, but tell me about the exercises. There's you're supposed to do them 5 times a day, 5 repetitions, and there's 5 exercises.
So on our website, we have a video that explain the product and the exercise. And then we section the video into 5 shorter videos, each one of them for one of the exercises. Just for the sake of making people remember them, we call them the 5-5-5. Maybe I went through physical therapy for my back, and I know many people who go through physical therapy. And one of the most difficult thing going through a physical therapy is to do the homework exercise. when the physical therapists tell you, I want you to do this, I want to do that, it's hard to remember. It's hard to remember, okay, which one he said? So that's why we try to make it so easy to remember. That's why we call it 5-5-5-5, which means you do 5 times a day, 5 exercises, 5 reps, and each rep is 5 seconds. So
Yeah,
when you,
that's
yeah, and then when you call it sniff your armpit, just people will laugh and say, oh, okay, that's easy to remember.
yeah.
And
Yeah.
yeah, so
I'm good.
people can just go to the website, see the exercises, and one time only, and then they will be remembered. My advice is that the dentist who's giving the patients their TMJaw kit is actually sits down with them the first time and shows them how to do the exercises. It only takes once, and the patient will remember them. They can do it while they're driving. They can do it while they're riding the bus. They can do it while they're walking on the treadmill at the gym. They can do these exercises in any position.
So that's actually a good point, is to have the dentist sit down, do the exercise with them, but also maybe do with the entire staff, have the staff
Oh,
on board,
absolutely.
everyone do the exercises. So the hygienists and the assistants can relay that information, and they're on board as well. And they can do it with the patients as well.
Hygienists actually, like hygienists always, some doctors, they train their hygienists to promote the products that they sell and the treatment that they do. It's, for some reason, patients trust hygienists in a very, very amazing way compared to how much they trust the dentist. So whenever the hygienist says, oh, I see that your teeth are a little bit discolored, would you like me to discuss with the doctor bleaching? It's much, and most of the patients say, yeah, let me do that. Or I see some crowding on your teeth. Would you like me to discuss with the doctor clear aligners or Invisalign for you? So hygienists do that all the time, and they can also see help that if they are trying to clean the patient's mouth and do some hygiene visit, and the patient's not able to open. If the patient's not opening more than 40 millimeters, 40 to 50 millimeters is the average opening, mouth opening. If the patient barely can open, and the hygienist is having a hard time going all the way to the posterior teeth to clean them up, she can tell the patient, I think you have TMJ problem. And one of the things we can do is try this product or give you a splint that will help you open your mouth better. And 6 months later, when they come for the cleaning, she can evaluate how much improvement in that.
Now, can you do like a lunch and learn with the staff and onboard them so that everyone understands? Because when you're adding something new like this in the office, it's so important to have everyone on the same page and
Oh,
understand that
absolutely.
we're offering this new form of treatment. And to tell you the truth, I find it exciting to add something new to the office,
Absolutely.
and it kind
I
of
would even go further, and I would show them a couple of the orthotics that I use,
Mhm.
and that will help tremendously in treating the TMJ, and getting rid of some of the symptoms, and especially the getting a better mouth opening. So I'll be more than happy to, absolutely.
So the TMJ, when I find it so intimidating, when we come out of dental school, we know very little about it. Like you said, it's such a mystery. And I do it myself. Patient comes in and they're having TMD symptoms. I'll refer them to the oral surgeon down the street because I just don't know enough about it, and I don't feel confident to try different modalities. So it is a very intimidating subject. Why is that? Why do you think? Is it, like you said,
It,
because
it,
there's
it's a new science. The
Mhm.
joint itself is very complicated. It's the only joint in the human body that has 2 components and controlled by hard tissue, which is the teeth. I mean, the elbow, the shoulder, the knee, they're like its own side. But the TMJ is the only joint that's bilateral, and it has a hard component, which is the teeth. Because when you close your teeth, that's it. That's when it stops. You cannot move the joint further after you are in full occlusion. And just recently, less than 100 years ago, doctors started wanting to learn more about it, try to understand it, trying to see how they can manipulate it or control its position and its location. What's worse than being intimidated by it, what's worse than not knowing what to do and sending them out, is that I see a lot of cases where a patient walks into the dental office saying I have a pain in my molar area, and the dentist will end up doing a root canal, and then and it's not a dental problem, it's a TMJ problem, because many of the trigger points that cause pain in the teeth come from the TMJ.
Yeah.
And it's puzzling sometimes that they will do root canal and then the tooth is not healing, the pain is still there. Oh, maybe the tooth is cracked, let's take it out, the pain is still there. And I've seen many of these cases where that's more dangerous than not knowing what to do. So that is something that so the component of it itself is complicated, but when you understand it, it makes so much sense. It's so logical and it's so beautiful to understand it.
Sounds like such a nightmare situation where you've just, you've referred the patient to the endodontist. The endodontist does a root canal, it doesn't get better, and then the tooth is thought to be cracked, it's removed, and they still have pain. No one's happy when that happens. So you made such a good point that the end point of the TMJ, the end point is the teeth, which is a hard structure, whereas pretty much every other joint in the body is the muscles or range of motion of the muscles, whereas the TMJ, it's the teeth. And patients can have bad habits, they can have malaligned teeth, they can, like you said, there's a psychological component to it. Is myofascial pain, is that one of the most common forms of TMD, where there's pain in, like you said, the neck, the jaw, maybe even the trapezius, so they're getting headaches? Is that the most common form of pain?
Well, there are different kinds of pain. Many of the temporalis pain goes to the head and cause headaches. And patients go to neurologists taking really aggressive medication that it's not needed. It's just need to relax the temporalis. And the temporalis is what moves the mandible back and forward. And if the mandible is not in the right place, the temporalis is always on fire. It's always spasm. I give the example to my patients. Imagine you go to the gym and you grab 2 dumbbells and you curl your biceps. You pull your biceps up. The muscles are tense, right? Imagine walking around the whole day holding the dumbbells like this. What will happen to these muscles? It will become sore. Do that for 10 years. These muscles will be painful. So imagine that the mandible is the dumbbell or the weight, and the muscles of the TMJ are the biceps, and they're always pulling the mandible up more than they should, and they're always in a tense position. So eventually they will cause this kind of pain. What worse than that, when the disc itself starts being pulled out of where it should be, and you feel that popping. What's worse than that, when the condyle, because of either ortho or because of posterior long span bridges on one side, we end up dislocating the condyle backwards posteriorly and start pushing on the posterior space of the TMJ, pushing on the ears and causing all kind of pain that they're going to the ENT trying to find what's the problem. So there's several symptoms that patients come to us with it. And they myofascial pain or pain of the facial muscles and the neck muscles are definitely one of the most common ones.
Can you explain what, and I've heard this term so much more lately, is myofunctional therapy? It seems to be like a buzzword term, and I'm hearing more and more about it. Can you explain what that is?
It's pretty much what the neuromuscular school of thought uses. The neuromuscular school of thought is the school of thought that believes if you put the occlusion in the right place, you will relax the muscles completely, and most of the pain that's caused around the TMJ will be gone. And it's a very good way of treating many of the patients of TMJ or TMD, but it's not the full picture. And I found so much success in treating patients by relaxing the muscles through myofunctional appliances or neuromuscular orthotics. The point of it is that orthotics that are made, they're not just like a night guard, they're not just like a splint. It actually guides your mandible to go in the most comfortable position. That comfortable position should be measured or should be determined through EMGs and like when I want to locate where the mandible is more comfortable, I fill the patient's face with electrodes and EMGs. and I have a screen in front of me, and I tell the patient, move your mandible up, down, right, left, forward, backward, until I see that all the muscles are comfortable in that position. That's when I shoot the bite, and I say that's when I need the bite to be guided to go there every day.
Mm-hmm.
And that is the myofunctional appliance job, is to move the mandible into a position when you close your mouth that is most comfortable to the muscles.
To relieve that tension. And
Uh-huh.
are you finding that a lot of people, this isn't just a nighttime thing, people are tense all day.
Yeah.
They're behind a computer, they're driving or whatever, they're working out, and they're constantly tensing their muscles. So it's not just a nighttime thing.
No, no, it's a 24-hour. Actually, some of them are designed so you can chew food with them.
Mm-hmm.
So you actually put in your mouth and you eat with them while they're in your mouth. And if a patient, let's say, missing a long span, there's a long span edentulous area on one side, and now they're chewing unilaterally on one side, that's one of the reasons. So after you stabilize them, you replace implants or you put bridge, whatever it is that's needed, so they can start chewing back on both sides and bring back the balance.
So, I mean, because I find that, some patients with TMD, it can be TMD, it can be debilitating. So you have the muscle um, tension, but then you add in if there's a disc injury or condyle injury
Mhm.
or arthritis,
Yep.
um, and some patients could have all of these things. So it can be a multifactorial issue.
Absolutely. It could be just start with one of them and then the rest follow. And it, especially that it's been 10, 20 years that they've been going through that, you'll find out that if it was the muscle pull, eventually they will start pulling on the condyle, and you'll see that the bone is actually growing in one side more than the other when we take a CT scan for the condyle. Sometimes you see the condyle surface is getting damaged as well. It's a localized arthritis, not necessarily systematic, but it's just so much uh, injury to the bone itself, and you start seeing irregularities in the surface of the condyle. So it could be all that. And one of the most common things that we see is that because of the too much pain and the headache, and the patient, not only if they end up developing a mental health problem, a psychological problem, and sometimes it's the opposite. Sometimes someone going through stress, they end up grinding on their teeth, doing so much damage to the disc and the condyle, and they end up developing TMD. So looking at the full picture is definitely one of the most wise things to do when you're treating a TMJ patient, looking at their stress level, mental health, their muscles, their teeth, history of bridges, crowns posteriorly, history of ortho. Many patients, when they do ortho, when they go through ortho, the mandible is entrapped in a position that's pushing the condyle back. So a comprehensive, holistic understanding of the situation is definitely one of the best things that's needed, or the most important things that needed to get a good outcome of the treatment.
So the psychological component, I can imagine, someone that's in constant pain is,
Mhm.
they're not a happy camper.
Absolutely.
So you're treating, not only treating the joint, the muscles, the teeth, but you're also, treating up here. Or do you find that sometimes you're like a therapist where you're trying to get to these patients and tell them, I am going to help you and we're going to get through this together, to try to kind of ease that psychological component to it?
See, I cannot legally do mental therapy counseling. I do have several therapists that I work with that I
Yeah.
sometimes send them to while we're
Yeah.
going through the treatment. Sometimes I send them also, there's a couple of physical therapists that I work with, and a couple of neurologists and ENTs that I keep them on my list of contacts that I need to reach out whenever it's needed. But yes, once you one of the most scariest thing that patient thinks something wrong with them. Like, do
Yeah.
I have cancer? Do I have something in my brain? They get all the CT scans and the MRIs for the brain, and the headache is not going away. And that scary feeling or thoughts affects you after a while. It wears you down.
Yeah.
So when they know, just knowing it's a TMJ, just by knowing that, it's a relief for many people.
Yeah. Oh, there's nothing worse than not knowing why you're in pain.
Absolutely.
The
Yeah,
pain
absolutely.
is awful, but not knowing. and then not having a plan to fix it is even worse. So I didn't hear you mention chiropractors or acupuncturists. Do you throw those into the mix as well anytime?
Yeah, I mean, if I definitely prefer physical therapists because they strengthen the muscles and relax them. Some chiropractors do understand the situation, and it's definitely a good idea to get the spine straightened out, because when you're imbalanced up here, it goes down throughout the whole system.
Yep.
If you are unable to bite properly, many people develop what's called lordosis, which is that their face, the forward head posture. And when you do that, it affects your spine as well. Or if you're unilaterally chewing on one side, eventually you'll develop some kind of tilt in the head. But no one walks with a tilted head, so you have to fix it from the back, from the atlas. So you end up fixing it. So now you get a chain reaction of problems from the TMJ all the way through the spine. So yes, straightening out those definitely will be helpful.
Yeah, amazing. Oh, thanks so much, Dr. Ahmed Soboh. Again, go to dealsfordentist.com. He is the founder of TMJaw, and you can find their promo offer, which is get a TMJaw kit for $79.95, or if you buy 10 or more, you can get it for $69.95, and then you can resell it to your patients for $100 to $150. So it's a great offer, and it sounds like you're doing a really good service to helping these patients that are in pain. So thank you so much for joining us.
My pleasure, Eric. Please, I'm at your service anytime there's a question about things related to TMJ. Feel free to reach out. Any of your audience or your followers, they'd like to talk to me anytime, they're more than welcome to reach out to me. It would be my pleasure.
Okay. Thank you. We'll be in touch.
Thank you. Have a good one.
You too.